Good afternoon, everyone, and welcome to the University of Michigan School of Public Health Epidemiology webinar. My name is Mary Beth Carroll, and I'm the Assistant Director of Student Affairs within the Office for Student Engagement and Practice. Today, we're going to be talking about occupational and environmental epidemiology. And as you can see, I'm joined by Dr. Sarah Agard and one of our current students, Troy Torin, and I'm going to have both of them introduce themselves. From there, we'll be able to take questions from the audience and really get to know you over this next half hour. Thanks again for joining us.
Hi, everyone. So I'm Sarah Agard. It's really nice to meet you. I'm glad you're here today. So my background is in environmental epidemiology. I have studied exposure science. I've studied epidemiology. And right now, my research is focused on how air pollution and noise in our communities impacts health. I've looked at outcomes ranging from respiratory endpoints and lung health to cardiovascular disease, and now I'm doing a lot of research in terms of brain health and Alzheimer's disease.
Hi everyone, my name is Troy. I am a second year Occupational Environmental Epidemiology student. My background is actually in, I got my undergrad degree in anthropology and psychology, and then I worked for about 3 years doing community health work, and I decided that I wanted to pursue a further degree in epidemiology. I'm really excited.
Well, thank you for both of us being there. And again, to those of you logged in, please feel free to share in the chat box whether you're an admitted student or you're a prospective student, and please feel free to ask any questions that you have too. Before we dive into the questions that you have, a question that I have for you, Dr. Agard, would be what courses do you teach at Michigan Public Health?
Yeah, so I teach a range of courses. I teach some of our epi methods courses. So an advanced methods course for our doctoral students. I'm also about to start teaching a course online for epi methods. And in addition, I teach a course on statistical programming using the SAS programming language, where students will learn how to code things, but also learn a lot about data management and thinking critically about data sets.
Okay, very cool. Do you by chance, Troy, have a favorite class that you've taken, either at the School of Public Health or around the University of Michigan?
Well, other than Sarah
Thank you.
So many. Environmental epidemiology with Marie Hall. I'm in a class right now that we're doing programming in R. I really enjoyed that one. I think it's very useful.
Yeah. One of the great things about the University of Michigan is the interdisciplinary nature of the university. And as a current student at Public Health, you can take classes at any of the 19 schools or colleges. With over 99 graduate programs ranked top 10 in the country, it's cool to be able to learn from leaders within other fields. So have you taken any other classes at other schools, or do you have some areas in mind?
Yeah, I wish I took a class in another school, but I have an opportunity. I work with different social work.
Oh, very cool.
So I get to expand my knowledge and skills that way.
Okay.
But I would definitely recommend and encourage everyone to take another course in a different college.
Yeah, very cool. In terms of the OEE program at Michigan, a question for both of you would be, what would you say is the differentiator in comparison to other programs if students are thinking of applying, or if they're admitted and they're in that decision-making process? What really makes Michigan Public Health stand out?
I mean, I think, you sort of touched upon it a little bit in terms of how many different, groups around campus there are. It's an extremely collaborative, environment here at Michigan. I've been at a lot of different universities over my training periods, and really Michigan's collaboration is like none else I've ever seen. So I think that's amazing. That really gives students, right, like Troy, the opportunity to collaborate with people in many different areas. I also really like our internship program. So each summer, between the first year and the second year, students go out and we'll do an internship in the field where they really can start to try out different sort of career paths. We've had people go into, consulting. We've had people try research. And for me, I'm always envious because it looks like so much fun, but I think that's a really nice feature of the student experience, to give people, real life practical application in addition to the courseroom, coursework.
Yeah, very cool. For those who are prospective students and who are thinking of applying, what piece of advice would either of you give them? If you could kind of talk to yourself a couple years ago, or if you could talk to some students prior to them starting, what advice would you have for them?
For me, it was definitely once I came to Michigan. So I'm from the West Coast, and so I came out for Admitted Students Day. And I just felt like the environment was really warm and welcoming, and that really I went with my gut. Like, okay, it seems like a really great university, and but just once I got here, even though it was really cold, I was like, this is a really good university. That was go with your gut.
And in regards to the weather, it is true that we have all 4 seasons in Michigan. But what I usually tell students is at the end of the day, it's 2 years, and really the investment in cold weather gear, including boots and hats and gloves, is important. And at the end of the day, you are here for the cold for the short amount of time, and at the end of the day, the University of Michigan degree will really take you wherever you want to go. So hopefully that helps.
I was really worried about the cold, but
students are concerned about the cold.
But it's not do it. It's really not that big of a deal.
And embracing it is good too. Sweating is really fun. That's interesting.
What about life in Ann Arbor? I know that neither one of you were from here. What do you like to do? What's kind of the city life like? Life outside of the classroom, anything along those lines?
I really enjoy Ann Arbor. I live with students across different public health disciplines, and so when I get home, it's a really warm environment. We hang out. We go out. Yesterday, I went to dinner with a friend, and there's really great restaurants and. Even winter. I've been here winter and summer, so it's nice to see how it's family oriented, and I don't know, it's a fun environment, not just students.
And I would say Michigan or Ann Arbor is kind of unique. It's a small town, but it has a very big town feel to it. So we often get, very famous people coming through to perform at our theaters. We have, as you were saying, amazing food to eat and bars to go to. And the social life here is actually quite pleasant. It does have the nice Midwestern feel where people are kind to each other for no particular reason other than just to be kind, which is nice. It does have that nice feel to it. So I've had a great time here in Ann Arbor.
And also the football games, if you haven't been to one, to go to a football.
A lot of the same amenities as Dr. Agard mentioned that you'd find in a large metropolitan city, but a lot smaller scale, and the cost of living is a lot more affordable, which I think helps. For those of you out of state, the Detroit Metropolitan Airport is about 20-30 minutes from campus. There's also a Michigan Flyer bus that stops right outside of the School of Public Health if you are going to and from the airport. I know a lot of students are able to get there in a very inexpensive way. So know that we have students, from all over the state, all over the United States, and really all over the world. It's a pretty diverse community that you're a part of. So it's a great opportunity to meet people from all different types of backgrounds. One thing that we mentioned earlier that we didn't really dive into too much is the internship experience. And I know that you had a pretty great experience last summer. Would you be willing to share that with the group?
Sure. So last summer I worked with 2 professors. One professor's in school, so in the building called ISR, which is completely Institute of Social Research. So I worked with her doing a huge quantitative data set. And then for my other professor, we worked doing primary research collection, doing community-based participatory research with Detroit and Detroit residents. So I think I was looking for an experience that really bridged those 2 sides of epidemiology and focused on environmental epidemiology. So I really enjoyed that experience. Some people want to travel, go to a different state, and I would encourage, if that's your goal, to go ahead and do that, because when are you going to have a chance to do that again? But my goal was to learn different types of methods and stay local and in walking distance. So I really enjoyed my experience.
Very cool. Anything else in terms of the internship piece that you think might be helpful for students to know?
I just think it's an amazing opportunity for people. As I was saying, I perceive it as a way to try on careers, before you launch out into a more professional world. We've had, people go and, as Troy did, work doing research. I've had students study noise and sleep and air pollution and health and, consumer products and chemicals in those and health. We've had people occasionally will go out to government agencies for some summer training programs.
Yeah.
We've had people go internationally, as you were saying. So I had a student one year go out to Israel and do some research on air pollution and cardiovascular events. I just think it's one of those things, like if I had advice for students who do come, is really to take that opportunity and just embrace it and try whatever excites you. It's really a nice opportunity in that way.
Very cool. There's a question here from someone logged in asking about basically undergraduate majors, undergraduate experience, and asking, do you prefer applicants from the undergraduate public health program at U of M, or do all applicants have similar chances?
Yeah, I think that all applicants are definitely, welcome and accepted into the program. Actually, it's nice to have people with different backgrounds come because, as you were saying, it's such a multidisciplinary field that having all those perspectives and different trainings is highly valuable. I guess if I were to say anything about undergrad experience, I would just mention that epidemiology does have a strong quantitative component to it. So just being sure that, you have some math background to help you. Where students come in with less of a math background, there are opportunities at the school to help support those students. But I would say that's probably the one, sort of unifying theme across undergraduate majors that I would say would be helpful.
Yeah, any undergraduate coursework in stats or algebra, looking at Michigan's undergraduate curriculum, Stats 250 is always a good course to take and kind of see how you do. We want students to be successful. So anything that you can do, again, to brush up on your quantitative skills would be helpful. But again, as we've mentioned, we accept students from all different types of backgrounds. There's not a one size fits all. It truly is a holistic review process. And if you go on our website and look at the requirements section, you can read about that holistic review process and really see that there isn't one thing that's going to make or break your application. It's the total package that we're looking for. And within the essays, if you have areas of concern about your application, be sure to address that in the reflective essay. If you, for instance, feel as though you have a lower GPA or your quant scores aren't as high as you want, those are just a couple examples. Feel free to share that experience there, because that's where the faculty reviewers go. Hear about that. What else haven't we talked about? So I guess one thing to let you all know about, if you are logged in right now, active student, it's not too late to apply for our fall 2020 cohort. Our SOFIS application is open right now and we're still accepting applicants, so please feel free to reach out to any of us if you have questions about OEE after today's session. We are in the process of admitting students, so if you are admitted, you'll be getting information about our admitted graduate student day on Saturday, March 14th very soon.
Yeah, the only other thing I just wanted to add is that, so our OEE program is extremely fortunate in that we have training grants through the program.
That's great.
And so actually, we do often fund many of our students. Certainly, it's from the government, so U.S. citizenship is required, but among that, that population of OEE students, we are often able to help fund our students training through the program, which is a really wonderful opportunity. It also gives us a core, which we try and organize a lot of nice events. So there's seminar series that we host for our OEE students and faculty and staff. We have social events. We actually were just sending out emails recently about sponsoring another one for this winter, which has been really nice. So I think we have a really nice community. That's something that I think is a strength of our group. The faculty and the students and the staff really are engaged with each other and invested in the students' success, as you were saying. So
that's great.
It's a nice group.
Yeah. There's a question here from an admitted student, Shannon, and she's wondering if there are examples of students doing internships in environmental justice areas.
Yeah, absolutely. We have many different people at the school who are interested in environmental justice, and I think it's a critically important issue for our world right now. So that is absolutely an opportunity for people to do work in that area. And you come with an interest. Let's say that's your interest. As faculty, we certainly help you explore those interests and try and help place you in those areas.
Yeah, and I don't know
Yeah,
earlier if you mentioned where you got your internship, but one thing to, I guess, to touch on would be there are support services at all different levels here at the University of Michigan. Within the epidemiology department, there's an actual internship coordinator, and then at the school level, within the Office for Student Engagement and Practice, there's a full team of professional career staff to help as well. So many ways that students find internships, full-time employment, even job shadowing, networking, all of those different types of things. So know that really the opportunities are endless here. And when I talk to a lot of students, while they have access to all of these databases and things like that, I find that a lot of them find them through connections with professors and, talking about similar areas of interest and things like that. Are there any, things that have been particularly helpful to you as a current student?
For finding internships.
Yeah, or even resources, support services, anything along those lines.
I think as a first year, what was really helpful is for our epidemiology student organization pairs us, if we would liked, with a mentor for a second year. And that was really helpful, just getting my footing, getting the resources, and especially getting like a student perspective is really important. Yeah. So I found that resource really helpful. And then also, as you were mentioning, the Career Center here in School of Public Health, and through our coordinator, Kate, is amazing. So it's a very supportive environment, and I think you can see that through the different resources that we have.
Yeah. You mentioned a little bit about the student organization you're a part of, and here at the School of Public Health, we have over 30 student organizations that are not only department-based, but interest-based, and really it's a broad menu of opportunities. But can you talk about that and any other things that you're involved in outside of the classroom?
Yeah, so for campus, I am involved with Epidemiology's Diversity, Equity, and Inclusion Committee.
Great.
And I find that's a really, so there's about 5 students on the committee, and that's a really nice group and dynamic that we have. And just being part of the decision-making and understanding what's going on in the background, I think is important for students. What else am I involved in? So let's see. I think also I'm part of different like social justice groups through the School of Social Work. I think it's intergroup dialogue is something that's very in social, oh my gosh, I keep forgetting the different acronyms in that school, so it's just applied to be on that group. Other groups outside, I think I know some of my friends are like able to have positions like that are around campus, like with our garden and just things that are not school and academic based. I think is a really nice mixture of what I've been doing. Other people. Yeah,
very cool. One thing that I think a lot of people are always curious about when they hear the University of Michigan is, they feel as though it's such a large public research institution and it can be kind of intimidating. Can you guys talk a little bit about your experiences, maybe Dr. Agard, in working with students, your classroom environment, and kind of the overall feel of the epidemiology faculty and maybe even the school?
Yeah, I mean, I guess, it is a very large institution and that provides a lot of resources, but it also has the small feel to it. So I would say certainly, the faculty really get to know many of the students. We have individual academic advisees that we work with, as well as, students that we'll work with on their capstone projects. So every student in EPI will wind up doing a capstone research project and has a mentor on the faculty, which typically for at least a whole semester will involve a one-on-one interaction. And my experience, I mean, Troy, you can probably speak to it better than I, but it feels as if the students all really get to know each other. And
I came from a really small university, and so at first it was really intimidating to be at a large institution, but we really have especially within OEE, it's a smaller cohort than the general epid community, so it's actually really nice and really, I definitely know all the professors and know all the students, second years, first years, PhD. So in that sense, it doesn't become as intimidating.
It seems like we have another question here. If there are courses in the School of Public Health or other graduate schools in GIS?
Yeah. Yeah, so we actually have many different opportunities to learn about spatial, modeling and spatial statistics, GIS. So there's actually, I believe, a new course in GIS that one of our professors, Lee Pierce, is teaching. We have a spatial epidemiology course, which talks about, once you have the GIS data, how do you use it? There's a biostats course also in spatial statistics. And then through urban planning and stuff, I know that some of my former PhD students have taken some of the GIS training there and really enjoyed that. So there are many opportunities here for GIS. The software is provided to students on campus and resources available for its use.
Mm-hmm. Very cool. One other thing that we haven't touched on is all of our students are assigned a faculty advisor. Could you talk a little bit about maybe some of the students who you've mentored, what those relationships look like, the frequency of meetings, any information related to that?
Yeah, absolutely. So, I think it varies based on the student need, which is particularly nice. So there's some students that I'll meet with, maybe twice a year or something like that, help them pick their classes, make sure they're doing fine. And then other students are much more engaged and interested in helping in research, and then often we'll welcome them into our lab and do research together. For example, I think I had one of our current students, approach me in her first year of her master's program, right, and was interested in doing some research, so she worked with our group, and then I kept track with her over the summer, and now she's back and doing her capstone project with us. So it can be really nice.
A lot of epidemiology students in particular are interested in doing research. While it's not required as part of the curriculum, a lot of people are interested in those areas. What advice would you have to somebody who's hoping to gain those hard skills?
Yeah. I think one of the nice things about our program is that faculty actually do respond to student emails. So if you, if you do decide to come, reading our faculty websites, people are often putting up information about their projects, finding the folks who really match with your interests is great, and just popping an email. I regularly get emails from students saying, hey, I'm really excited by your research. Can we talk? And they'll come in and I talk with them. Sometimes I refer them to opportunities that I know. Sometimes they're able to work with me, or sometimes it's just, a nice conversation so that they can learn more about it. But I think, there are a lot of opportunities, both in our department, as you were saying, right, elsewhere around the school.
Yeah, very cool. Troy, looking ahead, this is your last semester, a very reflective time in your life. Have you thought about what the future might hold?
Yeah, so I'm applying for jobs.
Okay.
I'm going that route just because I just don't know what I'd want to do with the PhD yet. But there are a lot of people in my cohort that are going the PhD route, and I know that our school is very supportive of that route. But yes, I'm applying to jobs, fellowships. I have gone into the Career Center lots of times. That's the route I am going.
Great. Well, we have just a couple minutes left. With that, I guess any parting advice to those logged in, admitted or prospective students, anything that you want to share with them before we close out today's session?
Well, hard question. I guess I would just note that if anyone really has any extra questions afterwards, or of course, feel free to contact any of us. We're happy to respond via email if we can be helpful. It's a great place to be, so I'd say go blue.
If you can, able to attend Admitted Students Day, get a feel for yourself. Talk to faculty and students just to get different perspectives. And congratulations or good luck getting it. But
And if you do have specific questions, you can feel free to email us at sph.inquiries@umich.edu, and we'll put that email address in the chat box there. So please don't hesitate to reach out if you have questions. In conjunction with these folks here, the epidemiology department also has a program coordinator named Nancy Francis, and she is a wonderful resource to prospective and admitted students. We can also share her contact with you in the chat box. But with that, thank you so much for joining us today, and we hope you have a good rest of the day.